Hello friends, hope you all are doing great in your life. In this video, let me share about my personal experiences about the Shatkarma technique which I am getting trained right now from the Morarji Desai National Institute of Yoga. So for all those who don't know what is Shat Karma, a simple explanation. Shat means six and Karma means the techniques or the processes. So the six purification processes or the six cleansing processes that were described in the ancient system of yoga to purify the body, these practices are called as the Shat Karma practices. Initially, when Patanjali Maharishi gave the Ashtanga Yoga, there was no Shat Karma or the purification process. Then later in the Hatha Yoga Pradipika, Geranta Samhita, in all these books, these techniques were added. So as I have already done my MA in yoga and PG diploma in yoga, I was quite interested to learn about these practices because I felt I want these detox. See, in these days, like whenever we open a YouTube video, we are finding so many detoxification videos like dopamine detox, lung detox, brain detox. So, but even before all these videos have come, in all the traditional system of medicines like Ayurveda, yoga, and all these system of medicines, the detoxification techniques have always got a important has got so much importance that purifying the body is very essential part of the life, because in Ayurveda also there is something called Panchakarma, in which there are five detoxification techniques. So let me tell about what are the Shatkarma six techniques. So this includes Dauti, Basti, Neti, Tratak, Kapalapati and Nauli. So Dauti means it is the purification of the upper GI system by means of vomiting. In simple terms, I am saying, because this doesn't mean Dauti is just vomiting, because there are 13 types of Dauti, which includes cleaning right from the mouth till the anus. But for simplicity and for easy understanding, we can understand it like that. So the next thing is the Basti. Basti means the cleaning of the lower intestinal tract, which is by means of enema. So, and neti means cleaning of the nasal passages either with the help of the water or with the help of a thread. And tratak means it can be done with two ways, like jyoti tratak or bindu tratak. So this improves our focus, concentration, attention, and purifies our eyes. And Nauli, as we have already seen, Baba Ramdev ji, he performing Nauli, where he contracts his entire abdomen, just brings the rectus muscles out, and he rotates it over the abdomen. So the other technique which was left behind is uh, Kapalapati. Kapalapati means like forceful exhalation of the air through the nostrils, which is proposed to have. They are saying it will clear the nasal passages, and apart from that, it will also activate the frontal lobes. So in Panchakarma, there are five techniques, which again includes same vomiting technique, which is the Vamana, followed by Virechana, which is therapeutic purgation, and two types of uh, Basti or enema, followed by which it ends with bloodletting. So before this, this is called as Pradhan Karma, which is the main phase, and there is something called Purva Karma, which is the preparatory phases, which includes Pachana, Deepana, Svedana, and Snehana, which means oil massage, drugs to improve the digestifier, and like a process to bring sweat out of the body, which is actually happening in sauna. So, and it ends with like after the Pradhan Karma, it ends with dietary and lifestyle modification, so that they can maintain the purification which has been achieved through all these processes. So in this way, if you see now, so all these techniques has been available in the modern medicine also, modern days also, with some other form, like in some ways or the other. For example, this therapeutic purgation which we are doing for the endoscopy and colonoscopy, we usually clean the upper GI system and the lower GI system with the help of some bowel preparation solution, right? So in the similar way, like if you see sauna, these are also ways to bring out this sweat. So in this way, the nasal irrigation is also a scientific technique which has been widely practiced even in modern medicine. So in this way, so I wanted to learn about these techniques, so that, but bloodletting is also followed in Ayurveda, which says like when they to take out the impure blood. But in the modern day medicine, it is not practiced, but it is available in some other form, in the form of a blood donation. But we don't consider this as a impure blood and waste blood. We actually give it to others. So in this way, there is a conventional techniques as well as there is the scientific evidence, and there are so many things which are scientific evidence. So I wanted to learn all these things so that I can write a book, I can devise a technique through which we can systematically cleanse the body in a more and more scientific way, with least side effects, with those people who can practice it and with those people who cannot practice it. So this was the main aim for me to learn about this. Apart from that, I also strongly believe that none of this system of medicines individually is complete, either allopathy medicine or Ayurveda or Siddha, because like each department is never complete, right? The pulmonology medicine department, they are never complete. They need the support of all the other supporting medicine. The anesthesia department is never complete. The surgery department is never complete. Every department, there is a need for the interdisciplinary team. There is a need for collaboration from the various teams. In the similar way, the modern medicine also, we need collaboration from all the system of medicine. We have to take everything like acupuncture, music therapy, reiki, hypnotherapy, and inculcate all these things in various places of the treatment system, so that people benefit from all the system of medicine. So that's why I am also writing a book on the textbook of fundamentals of, I'm also writing a book on the topic textbook on fundamentals of integrative medicine, which describes the various system of medicines like Ayurveda, Siddha, Unani, homeopathy, naturopathy, allopathy, Savaripa, yoga, um, acupuncture, Reiki, hypnotherapy, osteopathy, chiropathy, manual therapy, aromatherapy, all the system of medicines, its basic history, principles, diagnostic, and the therapeutic modalities. So that like this book can be read by all the system of medicine people, so that they can have a basic overview of the different systems and they can utilize whenever it is needed. For example, currently I'm working at Safdarjung Hospital, VMMC and Safdarjung Hospital, which is the largest central government hospital under the government of India. So in VMMC, the in all the central government hospitals like VMMC, RML, and Lady Harding, it is mandatory that all the all system of medicines are also made available in the hospital, which means like Siddha, Ayurveda, Unani, homeopathy, naturopathy, yoga, all these system of doctors are already available in house inside this modern medicine. So once we come to know about these things, then only we can work in a more integrated way. These people right now, all the system of medicine, they are functioning completely independently. But what I am feeling is like everyone should have a knowledge, so that like Ayurveda people can collaborate with modern medicine, Siddha people can collaborate with modern medicine, Siddha and the Ayurveda can collaborate with each other. In this way, each and every system can collaborate with each other and work for the betterment of the people. Right. So now let's come back to the technique. So in the Shatkarma practice, in the Moraji Desai National Institute of Yoga, which is a national institute of yoga, it teaches Shatkarma practices for everyone over a period of 4 weeks, over the 2 weekends like Saturdays and Sundays, and which is from 7 a.m. to 10 a.m. So in the first day itself, what they were teaching us like all the techniques. So in the second week, in the Saturday, I already got some fever, because like the construction work is going on opposite to my house for a prolonged period, and my house owner has also made a cot which produces so much amount of wood dust, so which is also allergic. So I got some kind of URI, so I was feeling feverish. So I was asking my yoga instructor, should I do this? Yeah, you should definitely do this, because this will help you in getting better from the fever. So okay. So then I did it. So this Neti practice just cleared the nasal passages. Then I took a rest for the whole day. Then it settled. Then later again the Wednesday, again I got fever. So immediately, so as I worked in my AIMS, so all the people from various departments are my friends. So I called up my pulmonologist. So I asked him like I am suffering from all these things, like URI kind of symptoms, and my sputum has also turned yellow. What should I do now? She said like probably this might be a viral infection. Let you start some kind of antibiotics. He told. Then I started. So then it becomes 3 days. Then the third day, which is a Friday, so I noticed one thing. There was only yellowish sputum coming from only one side of the nostril, and the other side of the nostril there was nothing which is coming out. So immediately I called up my ENT friend. So and I asked him like, this is happening, like could this be a probable sinusitis? Yeah, if it is coming from one side of the nose, then it is sinusitis only, then you should start this antibiotic. That's what he said. So it's already evening, so I was also lazy, so I didn't start any antibiotics. And then again the Saturday came, so again I went to the practice. Then again I did the Neti, so which cleared some of the nasal passages. So it's fine for me. So then I asked in the evening again, and I asked him like, I am right now fine. I'm not having any symptoms. Should I really start antibiotics? Then he said like, if you are fine, you need not start antibiotics. If the nasal irrigation practice helps you, you can definitely do that. That's what they said. So then, so right from my childhood, now what happens is I have sensitivity to even a very small amount of dust. So when my mother cooks inside the kitchen, and if I'm sitting in my sitting in the hall also, the smoke which is coming, the very minimal amount of smoke which is coming also caused me so much of amount of allergy, which led to so much amount of sneezing for me. So even if I clean the house a little bit, some amount of dust, if they come, like it causes so much amount of mucus production and sneezing in my mouth. So what happened is, in the neti there are two types of neti. One is the gel neti, which is with the help of the water. The other one is called as the sutra neti. Sutra means thread. So with the help of this thread, we will insert this thread inside the nostril and we will take it out of the mouth. So that is called as the sutra neti. So this we can do with the help of the sutra neti also. And there is one more thing which is called as the rubber. This is made of the red rubber. This is a biocompatible material, but my yoga instructor clearly told that this rubber neti we should never use. We will go only with the sutra neti as described in the traditional technique. So last 3 times I tried, there was so much amount of sneezing. Everyone came and tried to help me out, but as it passes, like initially within few centimeters itself, I got so much amount of sneezing. So I used to sneeze on the opposite person, and so that then everyone said like, let's relax, and then I said, ma'am, so we use a technique. We put rice tube to the patients, where we use a lignocaine jelly to insert the tube. So lignocaine jelly is a kind of local anesthetic jelly which is used in so many procedures like rice tube administration, urinary catheterization, rectal examination. What it does is, like, it simply numbs the area and makes the area smooth for anything external agent to pass through. So what happens is, this body, anything which comes foreign, it wants to push it out. It doesn't want to keep any foreign material within the body, so that it can remain pure. So when a foreign material like thread comes, obviously it thinks as a foreign material, and it uses its immune system. Like, one of the protective mechanism is sneezing, one of the protective mechanism is mucus production, which it does to expel out the foreign material. So what is it is, like, I will this is like very hard for me, so I will bring the lignocaine jelly through which I can easily insert this tube, because this will numb and there will be no reaction. Then she said, like, we can use all the kind of things, like there is nothing harm, there is no harm in using such jelly, you can bring it tomorrow. So then what I did, then I brought the lignocaine jelly, then I inserted, it went very smoothly because there is no allergic reaction at all. So then I used this thread. You can see this thread is like comparatively very thin compared to this thread, the below one, right? So I inserted this thread completely, but what happened is, like, it completely coiled inside my nose and it didn't come out. So there were one of my batchmate who was also there. They had an extra sutra, so which they gave it to me. Then I inserted it and it smoothly came out through the nostril, and then I did with the other nostril. But what is the beauty is, when I did with the other nostril, what happened is, all the yellow sputum which was not coming out for the, so already it's been 5 days since the antibiotic is started. So and today I'm completing my antibiotic course also. So with the help of the Sutra Niti, all the yellow sputum that were accumulated in all these days, which never came out, which I was thinking like it is a sinusitis problem. The person also said, whether do you have, in sinusitis we usually have pain in that side. I never had any specific pain. So he said, like, if you have pain, no, if you don't have any active pain, you need not start anything. It's fine. We can wait and watch. So all those things that have been accumulated has come out. So it was quite surprising for me. So initially what I was thinking is, I just wanted to learn these practices, but I was thinking the Sutra Niti is one of the techniques which should definitely be avoided, because this is definitely harmful, because, like, especially for people like me who is like hypersensitive, it is causing so much amount of distress. And second thing, we never knew who smoke nasal cavity is more sensitive. Sometimes inserting something foreign material can cause epistaxis, some amount of bleeding from the nose, right? Apart from that, this can also cause some external damage to the soft tissues around that. So in this way I was like completely against this, like, but I just wanted to try. But after seeing this, then I found that there is something, this might not be useful for everyone, but this could be useful for some amount of people with some kind of disease. So this should be thoroughly studied. These western people, whenever they find something, and they are doing so much amount of research on this, and they're finding out the evidence beyond what is there, evidence beyond the technique. But in India, so we have given origin to so much amount of complementary and alternative therapies, but we have never done in-depth research to find out the evidence whether this actually works or not. So this is definitely useful, but definitely not for all. I can say this Sutra Neti technique has 100% side effects, very minimal to, like, even more side effects could also be there, because One of my colleague who has come, batchmate, he has come for the Shatkarma practice for the fourth time. He is already an expert in it, but he did this Sutra Neti technique, and he developed a tonsillitis. His tonsils has become enlarged. So this is one complication even for the experts. So apart from that, 100% everyone will have a sore throat feeling, because like something foreign is going over the smooth tissue, soft palate area. So definitely this will cause some amount of abrasions over there, debridement over there. So this will definitely give you a sore throat feeling, and all these things. Definitely there will be some kind of side effect, but who is worth taking the side effect, who this technique will really be beneficial, that has to be studied and the evidence has to be brought out. So that's what the thing I was about to say. Moreover, is a national institute of yoga. This is a national institute. Initially they used to have wards, but currently they don't have any wards. That right now it is a teaching institute. In this way, the Indian system of medicine, it has to be strengthened with strong human resources training, strong amount of research, patient treatment, everything should go inside this field to find out which is really useful. So this sensitivity which I am having, this is called as allergic rhinitis or chronic rhinitis, which means like when the other person gets exposed to the same amount of dustman, they won't react in the same way as I'm reacting. They will be reacting in a much milder way. So for the other people, it is so much of distressing. So what is the treatment that is given? These are called antihistamines. So we are not treating the root cause. So what is the thing that is causing so much of the sneezing and mucus production? So the mechanism the modern science has find out. So they are cutting one of the pathways so that this thing is not coming out. That doesn't mean you are prevented from allergies. The root cause is not treated, but you are just treating the symptom which is distressing to you. This is a kind of symptom management. So if you don't get treated with it, then they go till severe. This is also ultimately not treating this cause, but it has its own side effects. So allopathy in this form of treatment, na, so we are trading one side effect with the other. So we are trading somewhat manageable side effect to the most distressing side effect. This is a thing which is happening, but the root cause is not treated. But there is one more theoretical thing which is called as uh, uh, the chronic the desensitization technique, so which is actually theoretically mentioned when I was searching about this, like why could there be alternative technique for this. So what happens is, like this thread when inserted, it caused so much amount of sneezing for me, but when this thread is continuously inserted in a controlled way over a period of time, our body will definitely adapt to it. Because in Chanakya he gave some amount of poison to the king on a day-to-day basis every day, so that when the opponents, when they want to kill the king with the help of the poison, he will become resistant to it. This is not something weird, because even in the modern day there is some guy called Tim Fred. He made himself sting with so much amount of snakes over the period of past 18 years. So what will happen is, like with the help of the snake bites, he will develop antibody in this in his antibody. So right now this is the scientists are studying this, and this is called as the universal antivenom, because in the antivenom which is produced for the snake bite, whatever the drug that we are giving that is produced in India, it has India has four major types of snakes, and the venom that is produced from these four major type of snakes only, this will act against. If you got snake bite and if you are getting anti-snake venom drug, this will act against only these four snakes. It won't act against any other different kind of snake. So right now this guy has, when his blood was tested, he has antibodies for all the kind of snakes. So if this is given to other people, this will be helpful for any kind of snake bite. So this is a simple concept. So this kind of chronic desensitization technique is always there. It has always been there in allopathy. So this Sutra Neti could also be a potential thing for that, but we never knew unless and until we study. So the simple bottom line which I wanted to say is, the conventional system of medicine, although they look observed in multiple ways, for example, this vomiting, this doesn't make much sense to me, because like as an anesthetist we always used to keep the patients NPO, nil per oral, for at least 8 hours, so that their stomach becomes empty. If it is water, it gets emptied within maximum of 2 hours, right? So when the stomach is empty, what you are trying to cleanse, but what they say is, like we are trying to get out the pitta and the kaba, which is the mucus and the phlegm, out of the stomach. But whether this is scientific or not, we need more amount of evidence. Whether this technique is actually beneficial or not, we need more amount of evidence for this. So in this way, I'm what the bottom line which I want to say is, like there is some amount of benefit in each and amount of each different type of technique. They are not completely pseudo scientific. They have some amount of science, but more amount of research has to be done, more amount of scientific evidence has to be brought out. So this is the simple thing which I wanted to convey for this video. So if you like this video, please definitely give a like, and whatever the topics that you would like to know, please do leave it in comments. I would like to see you in one another useful video like this. Until then, it's Dr. Aravind signing off. Om Shakti.